Hi, this is Zach and Pete with the Alpine Rescue Team. Today we're going to be going over open pneumothorax, open chest wound, sucking chest wound, or three names for kind of the same medical condition, which is effectively a penetrating trauma to the chest wall that has penetrated from the outside air through the pleural space and into the lungs. Essentially what happens when a person receives this injury is that the air goes through from outside and fills the pleural space, which is like the area between the chest wall and the lungs, and prevents the lungs from being able to expand over time. So basically the person will suffocate. This is an emergent injury. This is an injury that, if possible, is going to be a helicopter evacuation. The patient will go downhill very quickly. But today we're going to go through this basic trauma procedures that you can go through to help maintain their life for a little longer period of time so you can get them to definitive care. So we will go through this from the beginning. Piece of patient. As always, when you approach the scene, the first thing you want to do is make sure that the scene is safe. Assess how many patients you have. I have one. Ask for permission to treat and put on BSI. Hi, my name is Zach. I'm with Alpine Rescue Team. Can I help you?
Yes, you may.
Go through the ABCs, make sure they have air rate, the breathing, their circulation. Person with a sucking chest wound, it will usually make noise, a little gurgle, you can hear it. There's a reason why it's called a sucking chest wound. As soon as I've addressed any other immediate life threats, such as arterial bleeding, I've made sure that he has an airway, he's breathing, and a pulse. I'm going to immediately treat that before I go through and do a head to toe or anything else. The idea behind this dressing is that you're going to need, go ahead and turn your side here, Pete. And lift up your shirt. If you have a real patient here, you're probably going to have to cut through the clothing with trauma shears. They're not going to want to take off their clothes. So say he was in an avalanche and he has an open hole in his chest right here. You can see through this, penetrates to his chest, sucking. He's going to be having trouble breathing at this point. And what we want to do is put a dressing over the wound that will, you can improvise this with anything. For us on the rescue team here, and anytime you have a small med pack, there's a biohazard pack, and there's multiple types of tape here. You can improvise, you can use anything with plastic and anything that will close off three sides. That's all that matters with this. So you expose the wound, see where that is. You're going to take anything that's plastic like this that is occlusive and put it over. You can have multiple, it can be folded like this, or it can be just one layer, essentially. You're going to lay that up against the chest here. Tape it on three sides. Pete's helping me here in a real rescue situation. You can't do it with one hand. It's nice to have another person help you hold it on. But it can be done with one person. One person and two hands. Another note here, if you don't have a biohazard bag or something like that, even gloves that you keep in your pack, I could take these gloves, I could cut them off, I could use that to make the occlusive dressing. So he has a hole through his chest right here. I have plastic over the wound and it's taped on three sides. So essentially, when he breathes in, this is going to suck down over him and prevent air from the outside coming into the pleural space. And then when he breathes out, this the pressure from inside of his lungs will push this open and air can escape out of this that's in the chest cavity. It won't fix it forever, but it'll give you a longer period of time to keep the patient alive until you get them to definitive care. So remember, it's very important to remember the principle, because there's a lot of ways to improvise. There's not like one standardized type of dressing that you do this with. Plastic and tape. Anything that can close it up, put a closure over the wound and put 3 sides on it that will close in when the patient breathes in and will blow out and leave a little hole for gas to escape from the lungs when they breathe out. That's the idea behind it. As soon as you get this done, the next thing you want to do is apply high flow oxygen with a non-rebreather mask, because the patient is going to be having issues with gas exchange. They're still not going to be breathing very well, and you want to maximize the amount of oxygen getting into their circulation so you can get them out of the field. And as soon as you do that, reassess vitals and get them out as soon as you possibly can. This is an emergent evac. This is an evacuation I would call a helicopter for if I had access to it, or I would just try to get them moving as quickly as possible to litter and as many people if helicopter transport was not an option. So, thank you.